Hi, welcome to this short demonstration on ACAFE, a computerised advancement for emergency hospital use. The application is based on datasets from the New South Wales Health website relating to adult asthma management, optimal treatment of chronic asthma, and information relating to triage categories. We start on the ACAFE application homepage. After entering our username and password, which is doctor and doctor again, the application opens up, allowing us to open an existing patient treatment file or to start a new patient treatment. In our example, we're going to start a new patient record, and we're going to enter in a first name here, patient, and a last name of a sample 4, and we'll give him a date of birth. Okay, choose the 9th, and we'll select male. Straight away we're taken to the triage categories and triage notes section. Here we'll just enter in some quick sample data here, and we'll select the triage category of 3, and we'll put him into the acute section and completed by a sample nurse. Okay, all we need to do is just press tab and it will take us to the patient assessment section. Essentially, what we're trying to achieve with ACAFE is to make it easier for clinicians to visualize the asthma management workflow, capture all the right data, and apply the correct standardized guidelines for asthma management, all based from the New South Wales Health website. What we'll do now is just enter in some data here for a sample asthma patient here. We've just entered in a presenting problem of wheeze, the history and associated symptoms. All these fields are from the asthma management guideline. There's a whole heap of other fields we can enter in, such as the social history, background, background medication. We'll just add in here Ventolin puff, 2 puffs there, and also allergies and respiratory examination, spirometry. Although we might find that we might be short on time, so we've also integrated a asthma severity grading, which is from the once again from the New South Wales Health website datasets there. So we'll just quickly add in here infrequent. No. At the end of completing our asthma severity grading, we're given here a severity status and recommendation based on the information provided. The system's automatically decided it's mild. As a clinician, we have the option to provide our own recommendation, which we'll set as mild as well, just to standardize the whole process. The way ACAFE has been designed is to follow strict compliance with the asthma management guidelines. Hence, the user is not able to move forward through the asthma clinical pathway until essential fields have been completed. Once those essential fields have been completed and we've updated our asthma severity recommendation, we're able to proceed to the management section. Here, the system automatically updates a suggested management plan for mild asthma. Here, the clinician can provide any suggested treatment orders. We'll just provide a neb. And any investigation orders. The suggested is no investigations needed. The suggested observation, routine observation, and a suggested management plan for mild asthma's disposition is discharge. By scrolling down, the actual management plan can be varied. Here we can change the number of doses and advise the administration. Also add additional medication as required. We can also provide intravenous fluid order, any consultation advice, and add any investigations outside of the suggested management plan. Since the disposition for mild asthma is to discharge, we don't need to complete a progress note, but that option is provided if we wish to provide any progress updates. The progress notes are handy for any patient reassessments and treatment follow-ups. So we'll just provide a standard here. As you can see, it's automatically updating our patient history and examination vital signs. We'll also just summary of the progress is stable, and provide a time to reassess 0 hours and 0 minutes. That way we'll have an automated progress note archived here for further reference. If we proceed to our disposition, in the disposition screen we can apply any discharge medications. Give him a Ventolin, and we can also automate the whole asthma management and smoking cessation advice. And we also have a printable discharge summary in a format which a patient can bring to their GP. So we'll just click on complete. Please confirm that you've checked the inhaler spacer technique. Okay. So we have two essential contents here. We have the discharge summary, which we can print out for the patient here, which includes all the essential details, and also the smoking cessation advice to assist the patient quit smoking, and also the asthma management plan. So that basically summarizes our project, our ACAFE project, incorporating the asthma management and action plan into one application, whilst also integrating the guidelines for optimal treatment of chronic respiratory diseases, all from the New South Wales Health website and the data sets which have been provided there. One of the benefits of this ACAFE system is that we're able to provide additional data in relation to triage times and other statistics which we can actually pull out here from the admin reports here, asthma specific, and we've also got hospital statistics on waiting times and times in the emergency department, and also evidence-based practice such as cortico treatment on discharge in patients who smoke. Sort of data which we can provide for further epidemiology research or academic research in this area.